Mask mandates are being lifted throughout our area. The Centers for Disease Control is expected to announce new guidelines next week. In New York, the indoor mask mandate for businesses has expired.
And in less than 2 weeks, Connecticut will lift its school mask mandate. A week later, New Jersey will do the exact same. But our next guest says in most cases, the move is premature and could prolong the pandemic.
We don't want to hear this. Joining us right now is the former U.S. Surgeon General, friend of Good Day New York, Purdue University Presidential Fellow, and Executive Director of Health Equity Initiatives, Dr. Jerome Adams. Doctor, nice to have you back on Good Day New York.
Great to be back with you, and we are moving in the right direction, so I'm not here to give everyone bad news.
Well, why do you still feel it's not time? Because the numbers in New York are really, minuscule at this point.
Well, every time we decide to prematurely roll back restrictions, we get a new variant and we end up further back than what we originally were. What I want people to understand is that we should be having these discussions. And you mentioned the CDC guidance coming out next week. I hope they lay out clear criteria for people to move forward, including low cases, low positivity, low transmission. But remember, we still had 2,500 people die yesterday. We are not quite out of the thick of this yet. You mentioned New York. I do believe that places in New York will be okay. But remember, 3 times as many Black and brown children died during the pandemic as white children. We had over 200,000 people lose a caregiver. 65% of those were people of color. So if we go too fast, too soon, we're going to hurt people, and we're going to hurt poor people and people of color.
Well, let's talk about children, because a lot of families are saying, especially out on Long Island, they don't want their kids wearing masks in school. And I'm just wondering, do you weigh in the mental health aspect of kids wearing a mask versus what it really does?
Well, you absolutely do. And when you're weighing that, you've got to say, okay, what else are we weighing? Are we weighing the vaccination rates of these schools? Are we weighing the mental health impacts of many of these children who've lost a caregiver due to COVID? Are we weighing the mental health impacts of them not being in school at all because we have another outbreak and the teachers can't come in, so the whole school is shut down? We need to weigh all these things. And if we're smart about it, then I believe many places in New York and the surrounding area are ready to relax masks. But if we're going to do that, let's make sure we're promoting vaccinations and that we're not harming certain communities.
When you talk about promoting vaccinations, you have to look at the stat that about 18% of parents have vaccinated their 5 to 11-year-olds. That's exactly a very low number. You're not going to pressure these parents to move past that number, and no matter how much campaigning you do with this. So what's the next step here? Well,
I actually respectfully disagree with you there. We see people getting vaccinated every single day, about 500,000 shots in America administered every single day. We always knew this was going to be the hard part of the curve. You have your early adopters and then you level off. What we need is engagement. What we need to do is make sure we're answering questions. What we need to do is make sure we're helping parents understand how their child being vaccinated benefits their ability to be able to stay in school and be safe individually, but also to maintain the educational environment. I don't think there's been enough outreach. And what I want to see is as masks go away, and they are going to go away, that we continue to double down on education and opportunities for people to get vaccinated to help us when the next variant comes in. It will come.
Yeah, so that's what I'm saying. You have the next variant coming, and there's going to be multiple ones coming. Is it best to just keep masks on the entire time? Because the CDC is relaxing their mask guidance for people that are vaccinated, for the general public, because they're using benchmarks. Now, you're saying that there are no benchmarks when it comes to kids, or you're saying there should be some, or what is your take on that?
I'm saying the CDC is doing, in theory, exactly what they should be doing and what they should have done long ago and given these people these benchmarks. The frustration comes, to your point, when you have a district in New York that says, look, we have almost no spread and we have high vaccination rates. Why are we still wearing masks? I agree with you. Those are places we should be relaxing. But we should also have good and clear criteria to say, in another district, this is where we perhaps shouldn't be relaxing mask mandates yet. If we lay out these criteria so that people can understand them, if we're honest and transparent with people, I think they'll understand when we say, look, it's too early for this district, Or this
But
district
doctor,
may need to return back to masks.
can I ask you a question about transparency, though? Because I think
Yes.
recently we've seen the fact that our governor, other governors have stated there's a difference between people dying with COVID and people dying from COVID. And all of a sudden that transparency was lifted. And we got an understanding of people, what I guess the danger was for people dying from COVID versus with COVID. So the transparency is not always there, and it seems like it comes a lot later.
Well, exactly, and that's a continual problem we have. But with the with versus of COVID, I want to remind people that we've been tracking the numbers in the same way the entire time. So the trends still matter. We still had a tremendous number of people in the hospital due to Omicron. Most of them were unvaccinated, and we still have 2,500 people dying yesterday. The CDC says we've had 1 million people now who've died over what we would have expected if COVID hadn't been here. So this with versus of, yes, it's important that we're transparent with people, but it's also important that we understand this is real. It's still harming people, particularly poor and minority communities, and we don't want to be too fast in removing measures and set ourselves back. Again, we're almost there, and we actually are there in many communities. We want to make sure we're following appropriate benchmarks.
Right. We've had such mixed messages on masks from the beginning, and I understand we've learned as we've evolved, but in the beginning, Dr. Adams, you said, we didn't need masks, they didn't amount to anything. Then you came on our show when you were U.S. Surgeon General, and you said, make your own mask. Those cloth masks are fantastic. And you showed us how to make a cloth mask, and now we hear those cloth masks don't do anything. So, a lot of us are just scratching our heads.
Well, the cloth masks actually do help. They don't help as much as a surgical mask or as a N95. And the virus has evolved. It's ugly to see the sausage get made, but we need to continue. And what I've done on your show is continue to be honest with people and say, look, what we thought we knew 2 weeks or 2 months ago has changed, and here's how you need to evolve and the way you protect yourself. That's what I love about you all. You bring me on. You always give me an opportunity to actually explain to people how the science has evolved. It's continuing to evolve in the right direction. And so I think we're in a better place, and we will be able to relax mask mandates in many communities really soon. We just don't want to do it for everyone too fast.
And that's why we like having you on, too, because you set us straight.
And we get to talk about Brittany.
And Brittany, I didn't realize that you like Brittany so much.
Hit me, baby, one more time.
I was going to say, we have to preface Britney Spears, because viewers are like, who's Britney?
Yeah. Well, we're on a first-name basis with the doctor, the good doctor. Former Surgeon General, Purdue University Executive Director of Health Equity Initiative, Dr. Jerome Adams, thank you so much again for coming on Good Day.
Thank you, everyone. Get the facts, and then hopefully you'll get your vax.
All right.
Oh, good one. Thank you.